We want people in Glasgow to be socially connected and to flourish. So we engaged impact funding partners to develop a new strategy to help reduce social isolation, loneliness, and health inequalities. The strategy is co-produced with the people of the city through 143 interviews and engagements with more than 40 stakeholder groups. These are the recommendations. People want to be able to access amenities and activities wherever they live, and for them to be affordable for all. Ensuring progress is made on national and local policies and strategies will help, as will mapping out what is publicly available, including an exercise to establish a complete view on the times and frequency of public transport. People in Glasgow want greater investment and better early intervention to help people live healthier lives. That means increasing health-related support services and activities to ensure better access. Podiatry and occupational healthcare should be stepped up to increase mobility and independence. More effective and affordable transport systems, accessible everywhere across the city, matters. To do this, we need engagement with disabled people at planning and implementation stage, a review of public transport routes, frequency, times and facilities, more accessible parking, a review into parking restrictions. People want to see increased funding and more equal distribution for sustainable and long-term impact to projects across the city, with professionals and local people working together to submit bids which will increase the impact of funding. Developing sustainable funding streams is incredibly important, as are developing opportunities to share best practice and resources, particularly to avoid duplication of services. Routes and facilities across the city need to be improved to ensure people in Glasgow feel confident and safe. Public transport should be improved, and so should roads and pavements with better infrastructure, including street lighting. We need to challenge stereotypes and perceptions by creating opportunities to celebrate the diversity of Glasgow City. Disabled people must be listened to and involved in making change. They should be engaged and involved in planning and implementation, including improving travel and transport for equal access, ensuring budgets and procurement processes do not discriminate or disadvantage disabled people when designing services, increasing funding for accessible activities. More support and resources is needed for unpaid carers, and there must be more childcare and befriending activities. To do this, we need to better know the number of unpaid carers. We also need to increase opportunities for unpaid carers to engage and improve their own health and well-being. And there must be more opportunities for affordable childcare, enabling parents and carers to engage more with other people and activities. People across Glasgow want improved communication, so people can have greater awareness of what's on. Ensuring ease of access to information across the city is vital. This includes information in different languages that is readily available, with local people helping to adapt current translation services. And we shouldn't over-rely on digital services to share information. There's a strong desire to eradicate stereotypes and create more opportunities to celebrate our diversity, with early intervention to tackle discriminatory behaviours and more thought when it comes to decision making and recruitment. Developing intergenerational activity will help too. People in Glasgow want to be able to volunteer their time, but that needs more local flexible opportunities and proper support for training needs. Progressing existing actions within the Volunteering Commitments Action Plan will help, as will an increase in funding to cover volunteer expenses. Organisations themselves need help to engage volunteers, and service delivery models might need to be adjusted. There's so much more we can do. Please view the full strategy and get involved in helping us to progress its recommendations.